First Nations have the poorest health outcomes of any group in Ontario. Suicide rates are 6 times the national average. Diabetes currently occurs in 6% of First Nations children as compared to 4% of the general population, and then 20% of the adult population compared to 12.5% of the general population. And these numbers are climbing. Over the past decade, they have risen by approximately 1/3. The complications in our communities from diabetes include amputation, dialysis, palliative care, and kidney and liver failure. Our people are continually failed by the healthcare system that appears to be broken. But over the last few years, I've learned that it's, in fact, not broken. The systems that are there provincially and federally are working exactly the way they're intended to, which is to take away the rights of our people to the lands that people have access to, lands and resources our people have. Healthcare is not broken. It's working exactly the way it's designed to, as another tool of colonialism. This shouldn't even be a discussion when we talk about humanity, when we talk about human rights for Indigenous people. What our nations ask for should be supported. To the delegates, I'm not sure if you've been on reserve in the North, but to those who work in First Nations, nursing stations are the first point of healthcare contact, and your role in First Nations is essential. Nurses are doing great work, but many of the things I'm talking about today are systemic, and there is so much good work being done despite the systemic issues. In addition to healthcare, our governments need to work on improving infrastructure and access to everything from education to housing and water, factors in the social determinants of health that can lessen the need for acute care and ease the burden on nursing stations. The things that happen there on reserve and in nursing station would not be allowed anywhere else in Ontario. The status quo in our communities that is normalized to seem acceptable would be unacceptable anywhere else in the province and across the country. There are people dying in our communities, and the level of services that we have to deal with would never be tolerated in Southern Ontario. I represent 24 fly-in First Nations in the North. The provision of healthcare services is mostly funded and coordinated by the federal government. I know that our people get caught in a jurisdictional black hole of health services because of who we are and where we live. Also, in the riding of Kiiwetinoong, we have airports in all these fly-in communities, which are lifelines in these communities in order to access services. In 2015, there were 2,750 medevacs in those 24 communities, 24 airports. That's an average of 8 per day at a cost of about $12,000 to $15,000 per medevac. The system that is in the North is a sickness system. It's not a health system. In my home community, we get 5 days of physician services per month, 60 days per year. Out of those 5 days, 2 of those are travel days, which leaves 3 days per month of physician services. That's what healthcare looks like in our communities. This is the other Ontario, the other Canada. I asked my colleagues from Southern Ontario, from the South, would you settle for only being able to see a doctor 3 days a month for a community of 600? When we talk about integration in a provincial sense, integration is more than that for First Nation communities because it creates a larger jurisdictional barrier for our people. Since being elected as an MPP, I ask often about the healthcare, the health. I get a response, it's a federal responsibility. I have asked many times for this government to respond to on-reserve services, physician services, health services, water, housing. I will continue to call out this government to quit using jurisdictional ambiguity as an excuse to let our children and our communities suffer and die. There are too many unnecessary deaths and needless suffering that's happening in our communities. Why are we not entitled to the same health and safety as everyone else in Ontario? This is not acceptable because of the doublespeak that gets used when government politicians talk about First Nations health at Queen's Park. First Nations people have come forward and said to the government over and over that our people are suffering and are provided substandard services. Yet governments, led by Liberals and Conservatives, are stubbornly consistent and listening to, but not hearing us. It is my hope that professionals such as yourself continue the valuable work you do to provide care and commit yourselves to ongoing learning about the legacy of residential schools, treaties, Indigenous rights, and our ways of life. You have the power at the bedside to make positive change in the way Indigenous people are cared for. And as a large group of caring people who can collectively raise your voices to tell your elected representatives at Queen's Park and on Parliament Hill that the status quo will not be tolerated even one day longer. Miigwech.